Hello everyone, my name is Dr. Mark Burdorf. I'm a board certified chiropractic neurologist. I practice in Scottsdale, Arizona, and I also do science-based nutrition. So we are now in July of 2020, and I think with reasonable medical certainty, everybody's probably going to agree this year has been nothing but a bitch, okay? So what we have to do is move forward and get behind everything that's going on in the world. And what I want to talk to you today about is just some simple blood work. And there's many tests you can do, but I'm just going to talk about 4 simple ones. And I hope I put a point across to you to get them done and understand there's a difference between clinical measures on blood work and healthy measures. So we're going to talk about 4 tests today. And the first one I'm going to talk about is one called the BUN, which is the blood urea nitrogen. And basically, you're going to see that clinical range is 8 to 20 and the healthy range is narrow, and you can see that across the board because clinical range has sick people, okay? So it skews, it's a broader score, but you want to be healthy, and that's why this column is so much better to be in than that column. So if your blood urea nitrogen is low, you probably have some issues with your liver. If it's high, you probably have some issues with your kidneys. The next 2 thing we're looking at is called the SGOT, and again, if it's low, you're going to have issues with your liver and kidney, and if it's high, you probably have issues with your pancreas and gallbladder. The next one we're going to look at is the SGPT, and again, if it's low, you're probably dealing with issues of alcohol and chronic fatigue, and if it's high, you're going to be dealing with stuff with the liver, the pancreas, the gallbladder, okay? Now, the last one, vitamin D, and if you follow me at all on my social media, I've talked about repeatedly a lot, okay? And you'd be surprised, so few people know what their vitamin D level is. So, what I'm going to talk about is medical doctors think that 30 is okay. Well, 30 is not okay. You really want to have it a minimum of 50 to 70 because vitamin D has been shown to improve your immune system. Now, if you don't know your vitamin D level, I'm going to tell you to get it done, and we have self-pay prices, and I don't care who does it, but you should get it done. But if you are not taking vitamin D currently, you should, if you're a 100-pound girl, take at least 5,000 international units a day. Okay, if you're a 200-pound male, you should at least take 10,000 international units a day, but get tested because you want to make sure you're hanging out in that 50 to 70 range. Now, vitamin D, I used to always say the 3 C's, but now we got COVID, it's 4 C's. But vitamin D deficiency is also related to cancer, and cancer loves sugar. So there's 15 different cancers that are related to vitamin D deficiency, and the 2 important ones are are breast and colon, okay? Now, vitamin D deficiency is also related to cardiac issues, okay, because once again there's a dysregulation of insulin which controls the glucose, the sugars in your body. The long-term effects is cognition. So by having deficient vitamin D levels is going to have a huge influence on these 3 other tests. So I hope you learned something here today, and get your testing done, put it in front of me, and I can tell you specifically what supplements you really want to improve on or take, because the half-life of vitamin D is 15 days. Half-life of muscle is a couple of weeks. Half-life of your liver is 6 to 8 weeks, which means you can either destroy it, which a lot of people have been doing this year with poor exercise habits, poor diets, excess sugar, excess alcohol, or you can rehab it in that same window of time. So, if you find what I am saying interesting, schedule a consult at my office. You can go online at drburdorf.com. Follow me on social media, Dr. Mark Burdorf on Instagram. Have a great day.